Hello and welcome to Medical Terminology AHS 102. This is so exciting, and maybe it's going to be a little intimidating, but remember, I'm right here by your side. I am Dr. Shelley Safian, your Sherpa, your leader, your coach through this term. And as you are looking forward to whichever career or career path in healthcare that you are looking to take, you are going to need to know and understand the language of the land. Okay? You wouldn't move to Brazil and expect to work in a hospital without being able to speak Portuguese, right? I mean, I don't know, you couldn't even work in a cafe without speaking Portuguese. So, this is very important. It's also a challenge to learn a whole entirely new language when you're an adult. Okay? And because medical terminology is a combination of Latin and Greek with a little bit of Spanish, a little bit of French, a little bit of English thrown in, um, nobody on this planet speaks medical terminology as their first or native language. So you're all learning something new. And when you look, as you look at the terms, you'll recognize little parts and go, oh, that's just like the English word, or that's just like the Spanish word. And that's great. And together, we are going to teach you to be able to feel comfortable understanding medical terminology because that's your future. Okay? All right. So getting started in AHS 102, a few ground rules that you must know. First of all, only 2 absences are permitted. That's 2 weeks where you go without submitting any graded work at all. You can have 2 of those. I don't think you want them having those zeros factored into your final grade, but life happens, stuff happens, so that's okay. But I just want you to understand this because at the third absence, you will be automatically withdrawn from the course. And you don't want that because why would you go through all this to get in here in the first place? That doesn't make any sense. Okay. When it comes to homework or quizzes or anything like that, you get one single reopen. No, the final exam is not included in that. Okay. What that means is as we go through the course, you may find, oh man, I can't believe I totally forgot to take that quiz. Okay, you can ask me and I will reopen it for you. But just that one quiz or just that one homework assignment and then no more. Okay, so you're entitled to that. And by the time we get toward the end of the course, if you maybe weren't feeling well and one week you didn't like your grade, you can use that as your reopen. That's okay, but only one assignment, not one chapter, one assignment. Okay. All right, that's pretty generous. Back in the 1800s when I went to school, there was no such thing. All right, deadlines every single week. Monday night, 11:59 p.m. is your absolute latest due date. That's when everything for that week is due. Don't wait until the last minute. I promise you, don't wait until the last minute because that's almost assuring that your computer is going to knock out or you're going to lose power or somebody has to be taken to the emergency room or the clinic, the urgent care, whatever. I promise you. So don't wait till the last minute. And as we're starting today, we're starting this course. I want you to make out a schedule based on when you're at work or when you have other obligations. We all have 72 million obligations in addition to classwork. Okay? All of us. So start planning now. Every Tuesday, you'll read through the chapter. Every Wednesday, you'll do one assignment. Every Thursday, you'll do another assignment. Or every Tuesday, every Friday, every Saturday, even Sunday morning. That whatever works for you, plan it out, make it your habit. That is good organizational skills that your future employers are definitely wanting from you. All right. Now, when it comes to technology, I'm just going to tell you straight up, Chrome is the best for you to access this course and to access Connect, which we're going to talk about in 1 second. Okay? So it's downloadable, it's free. It does not cost you anything. You can use it with an Apple Macintosh computer. You can use it with a Windows-based computer. You can use it with a Linux computer, whatever. Chrome. Download it, use it. If you don't use it for anything else, I don't care. But use it for this because you know what? If you try to use another browser, glitches will happen. And when glitches happen, you're going to get frustrated. And you get frustrated, you're not going to be able to concentrate on learning medical terminology because you're going to be so frustrated. No need for that. No, there's no need for that. Okay. And just so you know, well in advance, in case nobody told you, in order to pass this class, your final grade must be 74.5% or higher. We all want higher, but 74.4 ain't going to cut it. And don't go, it's close. This is not horseshoes or hand grenades. You got to get a 74.5 or higher, and let's shoot for higher, higher. A nice 88. Oh, a 92. Wouldn't that be lovely? Okay. All right. And remember, you're not here alone. I'm sitting here right by your side, ready to support your learning 7 days a week. I promise you an answer to your email within 24 hours. Mm-hmm. Well, we'll do it. Okay. And technical support is available to you 24/7. Okay. So to complete your assignments, when you get into the course, you're going to go to the content menu, and you're going to do the start here. You have to go through all of that. That's all important information. But then you're going to get down to pairing with Connect. And that's where your online textbook is, okay? So that's where the chapters are, and that's where the assignments are upon which you will be graded, okay? So this is a very important step. So don't tempt fate in the wrong direction. Watch the instruction video, read the document, then do what it says. No, I know better. I have my own way of doing things. Nip, 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 nip. Just follow the instructions, and then you'll be connected with Connect, and then you'll be connected with the opportunity to have an A in this class. Who doesn't love that? I love that. You would love that. Okay. All right. When you get into each week, you're going to see week 1, you're going to see the student information form. Fill it out, please, and submit it. You need to do that by August 24th. And I know, don't look at the dates that are on there. I just use some old screen captures. But then you'll see the Connect and SmartBook orientation. Yes, use that. Watch it. It's a couple of minutes of your time that, again, will reduce the opportunity for frustration and grief for the whole rest of the semester. Okay? And then you're going to get into chapter 1. Chapters, the reading of the chapters have little things in them, so you can earn points toward your final grade. Don't just skip over it. Don't do it. You'll be sorry later. And then there's a PowerPoint presentation. I didn't do that one or any of those. I do this one. But I may offer you some more in my own inimitable way of explaining things, so that way you have 2 ways to learn and understand and have it explained, okay? So that can only help, right? Okay. And then you have a homework, that's a graded thing, and then a quiz, that's a graded thing. And that's pretty common each week, okay? You are responsible for getting everything done within that by no later than Monday night, okay? Okay. All right. Please, please, please listen to this. I want you to today create a contingency plan. What will you do? This is for your online, you're taking courses online. Maybe you've never done it before, even if you have. You need a contingency plan already worked out. What if you lose power in your neighborhood or internet service in your neighborhood? And those things, do not call ahead and make appointments, okay? So you can get your work done sooner. That's surprise, no power. Surprise, no internet service. I know, I go through it, okay? So I want you to plan now. Which one of your family or your friends or your neighbors can you go to and maybe use their computer? Where is the local public library? What hours are they open? How does that compare with your work hours if you are having a job right now? Or and also if you have a laptop, you can take your laptop and go to places like McDonald's, Wendy's, Panera. They have free Wi-Fi. So you can go order a cup of coffee or a smoothie and sit there and get your homework done. Piece of cake. No excuses. I hate excuses. We work in healthcare. Excuses get in the way of proper healthcare delivery. Whether you're going to be a medical coder or a nurse, whether you're going to be a surge tech or a massage therapist, no, we don't make excuses. We're there to help patients who are in need. Okay. Now, the second part of your contingency plan is what if your computer dies? Whether you're using a laptop, a tablet, or a desktop, you know, sorry to say, it happens. They pass away, or you might drop something. And I'm going to tell you now from Historic, I've been teaching since the year 2000, and I've been teaching online since 2006. Okay? Oh my gosh, that's almost 20 years. All right, but so I got a lot of input, I got a lot of data to analyze, and the data that I analyze says doing your homework on your phone is not going to be working well, and again, not conducive to this. Okay? So again, if your computer dies, laptop, desktop, tablet, whatever you're using, again, check out your family, your friends, your neighbors, who will let you go over there and perch for an hour so that you can use their computer to get your coursework done. Also, Aaron Rent-A-Center and other furniture rent-a-centers. These are places that rent furniture. Many of them across the country now also rent laptops, and they rent them by the week. So you can rent a laptop for a week until your computer gets fixed, whatever. And if you are in Sumter, you can always go to one of the CCTC campuses and work in the computer lab. If that's your choice, I want you today to call the school and find out when the computer lab is open for you, what days of the week, what hours of the day, so you already know the answer and you can plan should something go awry. If you plan for it, you won't need the plan. If you don't plan, then you'll need the plan. Then you'll be sorry that you didn't have a plan. So plan, okay? This is very old-fashioned, but I am telling you how much it's going to help you. Get a paper, listen to me, a paper medical dictionary. Merriam-Webster Medical Dictionary is only $6 on Amazon.com. You can buy a paper medical dictionary wherever you want, from whatever facility you want, however you want, whatever brand you want, as long as it's a medical dictionary, not a regular dictionary, a medical dictionary. But the Merriam-Webster, it's small. Like I said, it's only $6 on Amazon. And if you have an Amazon account, you don't even have to pay shipping, and you'll have it right away. I promise you, this is going to really, really make a difference in your ability to learn medical terminology. Because if you do what I say, and this is what I'm saying, every time you encounter a word that you don't understand, I want you to stop and look it up in the dictionary. That's why I want you to have this paper dictionary so you can keep it by your side while you are working on reading the chapters and doing the assignments, okay? Every time you encounter a word that you don't know right off the top of your head for sure, I want you to stop and I want you to look it up. Because you know what's going to happen is when you look it up, first of all, you're getting the accurate definition of that word, okay? And second of all, you look up that same word 3, 4 times, it is now permanently in your brain, and you will know it not only for this course, but when you get on the job. This is how your human brain works. I'm assuming y'all are human. Okay. All right. I am human. I am not AI. Okay. All right. It is wise when you listen to those who come before you who have more experience in the area and can give you helpful hints and advice, and that's exactly what this is. All right, now I'll give you a little introduction into medical terminology to get you started, get your feet a little wet, okay? Many, not all, but many medical terms are made up of up to 3 parts. There's a prefix, a root, and a suffix, and they all get smushed together, which is why you'll notice that medical terms sometimes can be incredibly long, like esophagogastroduodenoscopy. Yeah, that's what I'm saying. Okay, so not all terms will have a prefix. That's like the adjective. Okay, all of them will have a root, which is the identifies the anatomical site that the word is describing or talking about. And there are words that will have more than one root. Okay, because you may have a procedure or a diagnosis that's affecting more than one anatomical site, a place on the body. And then the suffix is going to tell you whether this is a condition, like a diagnosis, or whether this is a circumstance, such as a procedure. Okay? So this is a lot that you can tell, and you're going to start out learning about prefixes, roots, and suffixes in your first chapter, at least maybe the first few chapters. And you really want to pay attention to this because this is going to make your life much easier. Because even when you get to a word that you don't necessarily, you look at the whole word and you're just like, I don't know what that is. But when you start to take it apart, oh, now, okay, so I know the suffix is itis. Itis means inflammation. That means it's a diagnosis word, okay? So that's why we start here, because this is going to enable you to figure out words even later on that you don't know. And maybe you can't at that moment look them up in the dictionary, okay? All right. So a prefix is like an adjective. Not all medical terms have a prefix, but you will see prefixes like ankle, not, which does not talk about that part right between your foot and your leg. That's not what that ankle is. This ankle means fused or stiffened. Okay? Anti, this is not talking about your mother's sister or your father's sister. This is the word that means in front of or before. And those of you who may be familiar with the southeastern United States, you may have seen or heard of places that are called antebellum, like that's an antebellum mansion or an antebellum plantation or something like that. That ante is this ante, and that means from before, and bellum refers to the Civil War. So something that is antebellum means it was built before the Civil War. That's very old. Okay? So you see how you can learn parts and then take a whole word apart and figure it out. Okay? Gyna, for those of you who are women, you may have gone to a gynecologist. Gyna means woman or female. Ologist means a person who has studied. Okay? And then tachy, fast means fast or rapid. Those of you who are into cars may have a car with not only a speedometer on your dashboard, but you may have a tachometer. The tachometer will tell you how fast your engine is revving. Not the speed that the tires are going, but how fast your engine is revving. So tachy means fast. Somebody has a tachy, if you have a word, cardio, tachy. I can't think of a word now. See, look at that. But anyway, my brain is stuck in the car. All right, but so tachy means fast or rapid. Okay? Tachydyspnea means breathing fast. Dyspnea means odd breath. Tachy fast. Okay, you'll see more. I don't know why my brain went blank. All right. The root word tells you the anatomical site that the word is referring to somewhere in the body, from the head to the toes and all the way to the fingertips. So those root, that's going to be the Latin and or Greek, Spanish, whatever term for that body part. So cardio, some of you may exercise, go to the gym, you do cardio. You know that cardio gets your heartbeat up. That's where that comes from. Cardio means heart. Salping, ladies, are your fallopian tubes, the little passageway from the ovaries to the uterus as the egg flows. Okay? MYO refers to the muscle. Nephro, now be careful with this, NEPHRO, nephro is referring to a kidney. So somebody who has nephritis has an infection in their kidney. So that person with nephritis may go see a nephrologist, kidneyologist, person who studies, okay? You see how you can put these things together and take them apart. And neuro, Neuro, has to do with the nervous system. That's just a couple. We have 14 body systems, and each system has multiple parts. Okay. And the last part, as I said, is the suffix. And that is telling you what we're talking about, what the condition is, or perhaps what the procedure may be. So, neuralgia, algesia, the suffix algesia, means this patient is in pain. Neuralgesia means this patient is having nerve pain. Emia is blood. So if you're talking, if this suffix is emia, you know you're talking about something having to do with the blood. Itis, I mentioned before, you're probably familiar with this. Somebody may have an infection, and you know itis means inflammation. Lepsy, like epilepsy, but epi is the body part, that's the root. Lepsy is talking about the seizure. And stenosis, I love this. The stenosis is narrowing. And the way I always remember what stenosis means is I think about the highway during traffic hour, okay? You know, where all the cars are jammed? Okay, but then there's an accident in the right lane. So now the right lane is blocked off and we only have 3 out of 4 lanes to go, and so everything is all backed up. That's a stenosis of the highway. That's how I remember it. And that can also help you as you're learning about these conditions. If somebody has a stenosis in a vein or an artery, that means the blood is having to flow in only 3 lanes instead of 4, or even 2 lanes instead of 4. And you can understand, you can visualize, right, that backup, what that problem is. And that helps you to understand no matter what role you're playing. Okay. All right. Also, I'm sorry to tell you this, but spelling is absolutely critical, critical, critical. Okay? Every letter is important. And here's an example, aphasia and aphasia. Both of these words are pronounced exactly the same. They sound exactly the same. You have to look at the spelling. Aphasia with an S is a patient who has the inability to form speech. This is a neurological condition that often affects stroke patients. Okay? So if you think of aphasia, S for speech, this is a patient who cannot talk, but they cannot talk because their brain cannot figure out the words and how to say the words. Okay? Which is very specific. Because people might not be able to talk because they have laryngitis, right? There might be something wrong with their larynx. That's not aphasia. That's laryngitis. Okay? So each word means something very specific. Now, aphasia with a G is a diagnosis, a condition that says this patient is unable to swallow. It might be a stenosis of the esophagus. It might be a problem with the epiglottis. G, if you think about the G in aphasia, think digestive or gut. They can't eat. These patients can't eat because they can't swallow. Okay? So this is very, very important. And you are going to encounter words with like 29 letters in them. And there might be one letter in the middle or in the beginning that's different. You got to pay attention. You got to pay attention. Okay. Another example of how every letter is important. Again, two words sound the same. Ilium, ilium. Spelled differently, mean different things. Ilium with the E is an anatomical site at the end of the small intestine, right where the small intestine meets the large intestine. And that's where your appendix is in that area. Your appendix is kind of like the gatekeeper. Okay, we won't get into that. Okay, so ileum with an E is the end of the small intestine. See how you can remember that? E, end, okay? Whereas ileum with an I is actually part of the skeletal system. It's the uppermost part of the pelvis. You know, your hip bone. Okay? So this is, I'm telling you right up front, it's important. You're going to have to pay attention. Absolutely pay attention. And the last little piece of I want to leave you with as you enter into this course is healthcare, because of these long and complicated words like esophagogastroduodenoscopy, esophagus, gastro, stomach, duoden for duodenum. Oscopy is a procedure in which the doctor will put a camera down the patient's throat to view the esophagus, the stomach, and the duodenum. Okay? All right. So because these words are so incredibly long and complicated and very important, we in healthcare use a lot of abbreviations. Now, that's a wonderful thing, makes life so much easier. However, you must understand that a lot of the abbreviations mean more than one thing. So you got to make sure that you are understanding the meaning of the abbreviation the way it was meant by whoever used the abbreviation. And if you're the one using the abbreviation, you got to make sure that those who are listening to you or reading what you wrote understand which meaning you mean. Okay? For example, AC could mean before meals, which is from the Latin, or it could mean anterior chamber of the heart, or it could mean acromioclavicular, which is right here in your shoulder. Okay? A CVA may refer to a cerebrovascular accident, which is kind of a stroke. Maybe not a stroke. It could be a stroke. It is often a stroke. Or it could refer to costovertebral angle, which is a part of the spinal column. IM could be intramuscular if we're talking about administering a medication. It could be intramedullary, or it could stand for internal medicine. And NSD could stand for normal spontaneous delivery, which is if you're a pregnant woman, that's what you want. Or it could refer to normal standard dose with regard to medication. Okay, so what does this all mean? I hate to tell you this. You're going to have to pay attention to everything. You're going to have to pay attention to the little things, but you're not alone. And this is the most important thing. You are not alone. I am here 7 days a week. I promise a response to your emails within 24 hours. You can ask me questions by email and I will answer you. We can set up an appointment to talk on the phone. We can set up an appointment to Zoom or FaceTime or whatever. Okay? You are not alone. Just because you're sitting there in front of your computer with no other humans right around you. I'm sitting here in front of my computer with no other humans around you, although my dogs understand medical terminology very, very well from listening to me do these videos. Okay? All right. You're going to do great. You can definitely do this. Let's have a great term.